Since you mentioned side effects, I think it's important to talk a little bit about palliative care and the importance of palliative care, in my very humble opinion, from the very beginning. But what are your thoughts on that?
I think that palliative care, whether it's a conversation about palliative care with the medical oncologist or also a referral to a palliative care expert, ideally, should be a part of essentially the first conversation you have with a patient with small cell lung cancer. If they don't already have symptoms like pain or like shortness of breath or anxiety related to their diagnosis, those symptoms are all but inevitable. And so I think establishing a multidisciplinary team to manage those symptoms, to give the patients options for folks to reach out to, even to just bounce ideas off of really early on, is something that's overlooked. We approach this disease so emergently that sometimes we forget about the way the patient feels, right? We see the patient, they come in through the ER, they're very symptomatic, their labs are very abnormal, the tumor is huge, and we say, you have to start on therapy today, and we'll sort out the rest of the details later. And sometimes that's necessary, but I think we often overlook making sure that the patient's symptoms from the disease and from the treatment that we're getting ready to deliver aggressively are managed in a longitudinal way.
I can see what you're saying and how the urgency behind starting treatment, some of this stuff can get lost, but I think that's why it's important that people diagnosed, their caregivers and their loved ones understand, A, that palliative care is not hospice care. It's really a supportive care to help through symptoms that to Dr. Gay's point, either the cancer are giving you or the treatments to treat the cancer are giving you. And a lot of relief can be found by engaging in palliative care, and it's never too late. Just because maybe palliative care wasn't introduced as an option at the beginning doesn't mean it can't be introduced at any time during your treatment.
Yeah, and I want to reiterate a point that you made there, which is that palliative care and hospice care are not synonymous. Palliative care should be a part of virtually every cancer patient's care for the duration of their care, certainly while they have disease and while they're on treatment, if not beyond. And I think it's important for patients to realize that this is not a situation where you need to be a hero, right? If you're losing weight, I can't treat you as well. If you're so fatigued that you're not getting out of bed, or you're recurrently suffering pain that's preventing you from attending appointments and all of these things, these are all ways where the cancer treatment goes off the rails. And so making sure all of those symptoms that you require for your day-to-day, your activities of daily living, as we call them, make sure those symptoms are as well controlled as they can be so you can go about life as normally as possible. That leads to better success for me and for you.
Yeah, and I think it's important, and folks who are not new to this program have heard me say this before. I think quite often people in treatment are maybe a little anxious to talk with their healthcare providers about any side effects they may be having for fear of being taken off that treatment, when in reality, you need to talk about it as soon as it crops up so that we can then treat that and keep you on treatment, right?
So I'll be brave if you're brave. I'll be brave, but only